Welcome to this complete guide on teeth eruption, specifically designed for pediatric nursing and preparation for exams like NORCET, RRB, ESIC, and DHS. Let's begin with the anatomy. The tooth structure includes the crown, which is the visible part above the gum, the neck or cervix, and the root, which is embedded in the jawbone. The tooth tissues include enamel, the hardest substance, dentin, which forms the bulk, the pulp containing nerves and vessels, and cementum covering the root. The primary functions of teeth are mastication or chewing, speech, aesthetics, maintaining jawbone growth, and protecting oral cavity tissues. Teeth are classified into two main sets. Primary dentition, also called milk or temporary teeth, numbers 20 and lasts from 6 months to about 12 years. Permanent dentition or adult teeth numbers 32 and lasts from 6 years throughout life. The primary dental formula is a key exam alert. For one quadrant, it is 2-1-0-2, meaning 2 incisors, 1 canine, 0 premolars, and 2 molars, totaling 20 teeth. This chart shows the primary eruption chronology. Note the typical age range when each tooth type usually emerges. Here is a visual guide illustrating the location and appearance of the primary teeth. The rule of 4 provides an estimation of the number of primary teeth. The formula is age in months minus 6 equals the approximate number of teeth present. By 23 months, all 20 primary teeth should be present. Teething, or odontiasis, is the process of teeth breaking through the gums. It typically starts around 6 months. Teething syndrome is a cluster of mild, associated symptoms. Common signs and symptoms of teething include excessive drooling, chewing on objects, irritability, swollen gums, and a mild decrease in appetite. Teething can be managed using cold objects like chilled teething rings or gentle gum massage. Analgesics should only be used if prescribed. Avoid teething necklaces and topical anesthetics with benzocaine. It is a myth that teething causes high fever or diarrhea. Teething only causes a very mild temperature rise. High fever is usually due to an underlying infection, not the teeth themselves. The permanent dental formula is 2-1-2-3 for one quadrant, totaling 32 teeth. This includes 2 premolars and 3 molars per quadrant, with the third molar being the wisdom tooth. This detailed chart outlines the chronology for the eruption of permanent teeth. This visual guide illustrates the arrangement and types of permanent teeth in the mouth. The mixed dentition period occurs from 6 to 12 years, where both primary and permanent teeth are present. The ugly duckling stage is a transient, self-correcting malocclusion seen around 7 to 9 years. This table highlights key differences between primary and permanent dentition, useful for review. To quickly recap, the lower central incisor is the first tooth to erupt. There are 20 total primary teeth. The 6-year molar is the first permanent molar. Premolars are missing in the primary set. Dental anomalies include deviations in number, size, shape, or structure, such as natal teeth, delayed eruption, eruption cyst, and nursing bottle caries. Natal teeth are present at birth, and neonatal teeth erupt within the first 30 days. These are most commonly lower central incisors. They may require extraction if loose to prevent aspiration. Delayed eruption is defined as no teeth by 13 months. Common systemic causes include hypothyroidism, Down syndrome, rickets, and hypopituitarism. An eruption cyst, or hematoma, is a bluish-purple swelling over an erupting tooth. It usually ruptures spontaneously when the tooth erupts and generally requires no treatment. An eruption sequestrum is a tiny piece of non-viable bone overlying an erupting permanent molar. It is usually painless and either falls out spontaneously or is easily removed. Nursing bottle caries, or ECC, is caused by putting a baby to bed with milk or juice. This decay primarily affects the upper incisors. Prevention includes avoiding bottles in bed and transitioning to a cup by age 1. Hutchinson's teeth, characterized by peg-shaped and notched incisors, are a sign of congenital syphilis. Mulberry molars are also associated with this condition. Dental fluorosis, or mottled enamel, is caused by excessive fluoride intake during tooth development. It ranges from white patches to brown staining. Prevention focuses on defluoridation of water. Tetracycline staining causes permanent yellow-brown or gray discoloration due to antibiotic use during calcification. Tetracyclines are contraindicated during pregnancy and in children under 8 years old. Supernumerary teeth, or hyperdontia, are extra teeth. The most common type is mesiodons, which is found between the two upper central incisors. Anodontia is the complete absence of teeth. Hypodontia is the absence of a few teeth. These are often seen in ectodermal dysplasia. Third molars are the teeth most commonly missing. These are some general guidelines for maintaining good dental hygiene from infancy through childhood. In summary of anomalies, notched incisors are Hutchinson's teeth due to syphilis. Mottled enamel is fluorosis. Tetracycline causes yellow staining. Mesiodons is the most common supernumerary tooth. Question 1. Which is the first tooth to erupt? The correct answer is the lower central incisor, typically erupting between 6 and 10 months. Question 2. The first permanent tooth to erupt is the first permanent molar, which erupts at age 6, behind the last primary molar. Question 3. The total number of deciduous teeth in a 4-year-old child is 20, as the primary dentition is fully erupted by this age. Question 4. Nursing bottle caries mainly affects the maxillary anterior teeth or the upper incisors. Question 5. Vitamin D deficiency is associated with delayed eruption of teeth because it is essential for calcification, and its deficiency causes rickets. To summarize, remember 20 primary teeth with the 2-102 formula versus 32 permanent teeth. Key diseases include bottle caries, fluorosis, and syphilis. Thank you for watching this video.